All right. All right, so this is group 7 for the group presentations, and we're doing Western Sydney Local Health District. In this group, we have Talwin Ho, Claire Kwan, Denise Lemire, myself, Kunal Manalo, and Ashley. And we'll be presenting an environmental scan for the Western Sydney Local Health District. So a quick overview of what we'll be going through in this presentation. So a quick introduction about what Western Sydney is and who Western Sydney covers as a local health district, policies and plans of Western Sydney Local Health District, demographic overview and a profile of the local health district, as well as determinants of health and burden of disease of the population of Western Sydney Local Health District, and morbidity and mortality trends within this health district. So a quick introduction into Western Sydney Local Health District. It's one of the 15 local health districts in New South Wales. It is comprised of several hospitals, including Auburn, Mount Druitt Hospital, Blacktown, Westmead, Cumberland, Sydney Children's Network, including the Sydney Children's Hospital at Westmead, as well as other mental health services and community health services. Western Sydney is responsible for providing over 1.7 billion in public healthcare to this local health district. And is also a large and diverse health district with about half, so 46.8% of its local residents born overseas. Western Sydney Local Health District works in collaboration and partnership with other members of the community, including universities such as University of Sydney, Western Sydney University, and the Western Sydney Public Health Network in efforts to research and provide funding and governance to improve outcomes for the community and population of local health of Western Sydney Local Health District. So next will be Talwin.
Thanks, Camille. So as Camille said before, so the local health district is actually sitting within the state of New South Wales. So that means, and also health is technically a national agenda. So therefore, Western Sydney Local Health District operating within the state and the nation of Australia, it is subject to the federal and state health policies. So some example of federal policies that affecting how the Western Sydney Local Health District operates include, obviously not limited to, for example, number one is Medicare. Medicare is a scheme that gives Australian residents access to healthcare. It is federal government funded, and it will definitely affect the revenue streams of how Western Sydney Local Health District operates. Another example is hospital activity-based funding. This will affect how the Western Sydney Local Health District operates in terms of hospital staffing resources, because it is based on number of patients and also the service they utilize. And being funded federally, like how they operate, they also have to comply with the federal policies of patient records, reporting, and also the financial funding structure. Another major example was the National Health Aged Care Reform in 2012. There's a lot of reform involved, but two of the more noticeable one is the user paid model, where the elderly can start choosing the level of service and also different aged care facilities they use, or the home care package, where they have the choice of utilizing their providers in obtaining services whilst they're staying at home. Those type of consumer level will dramatically affect how the Western Sydney Local Health District healthcare system and how they serve the community. So that is for the federal level. In a state level, we have the New South Wales Health Service Agreement. The New South Wales Health Service Agreement is an agreement between New South Wales Health and also the Western Sydney Local Health District to deliver multiple health outcomes that is in line with the state strategies. So the alignment not just limited to things like values, cultures, community, workforce engagement, We're also looking at legislation, governance, performance frameworks, and also targeting with strategies, priorities, and budget and key performance indicators. That is also has to be in line with the state, the New South Wales Health Department's expectation and expected outcomes. So being said that, since Western Sydney Local Health District's policies are significantly affected by federal and state politics, when the government changes, it has potential to actually impact the direction of the health services, and that can also depend on the political ideology of different political parties. So the two noticeable date is the federal election needs to happen on or before the 2nd of November in 2019, and also the New South Wales state election on or before the 23rd of March 2019. Both of these can significantly impact how the Western Sydney Local Health District operates, how their fundings are, and also the strategies and directions. Next, please. So now we're onto the plans. So when we're looking at plans, we have the federal and state policies. The policy sets the directions or the expectation of how the Western Sydney Local Health District ought to perform. But they do need to have plans to achieve the outcome that was agreed on. So there is a Better West strategy plan that is established by Western Sydney Local Health District, and they target 6 health priorities, which is healthy people, integrated research, education and clinical care, improving patient experience, exceptional people, meaning developing the competence and all of the workforce, spending wisely, so meaning being financially responsible, and also information underpins everything we do. So that is talking about utilizing information, doing trendings, obtaining data, so we can so the health service can plan better. So one of the example could be My Health Record, which is due to be launched later this year. So instead of just the Better West strategic plan, there are also multiple smaller plans that actually support the actual plan itself. So some of the plans could include, for example, is the facility budget allocations. That is looking after facilities management, looking after the resourcing, which also works with the asset strategy plans. That is looking at how we're managing different hospitals, structures, looking at real estate, looking at plants and equipment, facilities, furniture, equipment. So in order for us able to utilize our resource better. Western Sydney Local Health District also have a workforce strategic framework. This is a human resource related strategies and plans that looking after to ensure that we develop a workforce that is capable and also have sufficient numbers to match the growing needs of Western Sydney Local Health District. So lastly, in terms of plans, beside the Western Sydney Local Health District plans, there are also multiple plans that actually happen in place either from federal governments or other state governments as well. So one of the more noticeable is the Primary Health Network Western Sydney Strategic Plan. This plan do work alongside with the Better West Strategic Plan, and they cover targeting primary health priorities on Aboriginal health, aged care, child and family, chronic conditions, mental health, population health. And also those strategic areas are also can be found in Western Sydney Local Health District's strategies. So they are in line, they are working with synergy with each other, and from an environmental scan point of view, it means that Western Sydney Local Health District, in order to operate, they have to plan internally and also work with external stakeholders in order to have a synergy to achieve the desired policy outcomes.
Okay, now we look at the current demographic profile for the district. According to Health Stats, in 2016, the local health district has a population of 950,000 people, and they have an equal proportion of male and female. As we can see from the graph on the right, This population is dominated by young people. It has 67% of the population is under 45 years old. And the largest group is 30 years old to 34 years old. If we look at the 2011 census data, this population has 69% of family with children, and which compared to the New South Wales total population, it's 8% higher. And it has 44% of family has children under 15 years old, which is what we can see from the 2016 population bar graph from the right. Next slide, please. Okay, this local health district also has a 1.6% of population, which is Aboriginal and Torres Strait Islanders. And it is the local health district with the largest urban ATSI population in New South Wales. According to Health Stat data, the population of the Aboriginals, they're very young again, and 80% of the population is under 45 years old, and a third of the population is under 15 years old. Western Local Health District, it also has an index of relative social disadvantage of 944. It is slightly under than the Australian average of 1,000, which suggests that there is a high proportion of relatively disadvantaged people with low income, no qualification, with low skill occupation in this area. And this 1.6% population of the Aboriginals and Torres Strait Islanders, they have 4,500 of them. They actually live in the most disadvantaged area within the local health district, which is the Blacktown southwestern area, which we can see from the map in the middle. The area highlighted in red. Number 4, which is the one that is the Blacktown Southwest. And the other with the lowest, the most disadvantaged, it's the Parramatta South area. They have an index of the relative social disadvantage with an average of 870. So you can see that it's really below the average of the local health district itself. Okay, next slide, please. Okay, within that, this local health district, according to the 2011 census data, we can see that the 36% of the population actually received income below the average weekly family income of 1,237 in year 2011. And most of these families are the one-parent families. Okay, next slide, please. Okay, the Western Sydney Local Health District, it's also a very diverse in culture and language spoken at home district. It has 46% of the population in the local health district was born overseas. Compared to New South Wales total population of 69%, so which is of 31%. So the local health district actually have quite a lot of people born overseas. India, which is top on the list, has 5.3%. China, second, 3.9%. And Philippines, the coming third, 3.4%. And English spoken at home was only 53% compared to the total population in New South Wales of 73%. And 6.2% within the Western Sydney Local Health District population speak Arabic, and 3.6% speaks Cantonese, and Mandarin 3.5% in the local health district. Next. Okay, so we now look at the projected demographic profile for this local health district. According to Health Stats, the estimate for the total population within this district would be more than 1 million by 2021. If we look at the numbers on the right-hand side, we can see that this local health district has it has the highest percentage growth among all the local health districts within New South Wales. It's 12.1%, and it's actually very high compared to the rest. And if we look at the data coming from the Centre of Epidemiology from the Western Sydney Local Health District in 2013, they actually estimated a similar trend of population to year 2030. It has a 1.13 million population in 2030, and the distribution of the population, it's roughly approximately the same as the current, so which is going to be a very young population too. But we can see that the growth for the population aged above 70%, there is a large percentage growth, with the most being the 80 to 84%, the population will be doubled by then.
So determinants of health is a term used for factors which are behavioural, biological, environmental or socioeconomic that affect health at the individual or population level. Individuals have a degree of control over some determinants, like in behavioural where they have risk behaviour or responses to health problems, but other determinants act mainly or entirely at a population level, like the environment. They are the key to prevention of disease and injury and help explain and predict trends and inequalities in health. They can act more directly to cause disease or be further back in the causal chain and act via a number of intermediary causes. So if you go into the next slide, we talk specifically about behavioural determinants of health. Now these can act directly to cause disease. So here I've specifically highlighted alcohol use as a risky behaviour. And as you can see, Western Sydney isn't as bad as other local health districts where alcohol consumption has been at levels posing long-term health risks. But then you look at the fruit and vegetables, which is why I've highlighted diet. And you'll notice that Western Sydney actually have the lowest intake of fruit and vegetables. So that's all for behavioural determinants. So then we go into biological determinants. So some of these are out of a person's control, as I said earlier, but others individuals can have a degree of control over. The biological determinants are obviously bodily states that pose direct and specific risks for health. For example, high blood pressure. They're often influenced by behaviours such as diet and physical activity, but can also be influenced by genetic, socioeconomical and physiological factors. So something like where I've highlighted here, your weight, your movement and balance, your strength and robustness, and your fitness. So if you have a look in the tables provided, the first one shows physical activity by behaviour type and local health district. If you have a look, the Western Sydney don't actually do too well in that sense for people aged 5 to 15. And then you also see that where we talk about other factors determining other determinants, you have a look at the next chart over to the right where you have overweight or obese adults by country of birth group. So because, as we spoke about in the demographic, that Western Sydney has a lot of people from different ethnicities, this is where it affects, it's a determinant of health in the sense that, well, people from other countries are just as overweight or as obese in Australia. And then you go to the chart down below where you have overweight or obese adults specifically in Western Sydney. So you show that they are pretty high. And then you have insufficient physical activity by local health district. And then you see Western Sydney aren't very physically active. But then this then links to the environmental determinants, which is on the next slide. So the physical activity, if you see in environmental determinants, you have something like built environment transport, and public open spaces. I'll go through it a little bit later on, where we'll actually see that because there's a lack of public open spaces in the Western Sydney Local Health District, people aren't exercising as much. But then in the same environmental determinants of health, you'll also notice that transport, because most people don't live in the area that they work, not many people are actually walking to work, they're all catching public transport. So in this one, housing quality. Housing quality is an important determinant of health. So studies have shown that Aboriginal families in both urban and rural settings live in houses which are often of poor quality, and those families have high rates of respiratory disease, injury and skin infections, and they can all be attributed to housing conditions. So then going on to the last determinant of health, which is socioeconomic. This one's a bigger determinant of health because it can include a lot more than what has just been listed. So I've just brought it down a little bit. So Western Sydney, unfortunately, is characterised by wealth at one end of this spectrum and significant social disadvantage at the other, bringing it with a range of complex health needs and social circumstances, which is why I've actually highlighted social class and caste. So the chart on the right shows potential preventable hospitalizations by socioeconomic status. And if you have a look at the fifth quintile, so the most disadvantaged people, they actually have the highest preventable hospitalizations. So then going on to the next slide. So how are all these determinants linked for the Western Sydney Local Health District? So I've picked one health issue, which is diabetes. Now, Western Sydney Local Health District is actually a very diabetogenic environment where the population, community, local economy and built environment make it difficult for the residents to engage in a healthy lifestyle. This is where I spoke about earlier, where in the Western Sydney Local Health District, they have low physical activity, they aren't purchasing fresh food and so their diet's poor, but then it links onto the biological determinants of increasing the factors of obesity and diabetes and chronic disease. But then going back to the environmental determinants, because there's a lack of social inclusive environment, people aren't exercising, people aren't doing things to prevent them from getting diabetes because the environment doesn't allow them to, which then leads to the biological determinants of obesity. So then going down to the socioeconomic determinants, the Western Sydney Local Health District had a low scoring for purchasing fresh food. They don't feel as safe and don't have security, and obviously they have low physical activity. So the most recent data indicates that only 7.1% of Western Sydney residents are eating the recommended daily intake of vegetables compared with other local health districts. Western Sydney rates of physical activity are at the lowest in New South Wales. Much of this is related to the environment in which the residents live. Change is required to enable the residents to purchase affordable fresh food, to have access to safe areas for physical exercise, and to reduce the dependency on car travel in favour of active transport. So the key drivers of obesity and the epidemic of diabetes are reduced physical activity, unhealthy food consumption, and lack of a socially inclusive environment, which is where we've seen the behavioural determinants, the biological determinants, and the environmental determinants, and the socioeconomic determinants are all linked in.
All right, so I'm talking about the burden of disease data for the population of Western Sydney Local Health District. So I'll just firstly define what burden of disease is. The AIHW defines it as the impact of a health condition within a local health district measured by financial cost, morbidity and mortality. Within the Western Sydney Local Health District, these are the ones that they identified in their most recent annual review as the most burdening diseases for its local population. So as Denise said, diabetes, heart failure, falls, all those is not a disease. It's one of the most common problems within this local health district. in 65-plus-year-olds, asthma, COPD, influenza, and pneumonia. So the 2016-2017 annual report actually stated that 57.3% of the Western Sydney Local Health District population had at least one of these 7 burden of diseases. It also highlights that there's a 10 to 20% higher prevalence of diabetes and respiratory diseases within the Western Sydney Local Health District, and it was significantly higher compared to other local health districts. The annual report also states that the Western Sydney Local Health District population has a chronic, has about 20% of the population has at least 2 or more of these chronic illnesses, and that's pretty major. There was a study conducted in 2017 of 28,000 patients at Blacktown and Mount Druitt Hospital. They just had a blood test, and the blood tests revealed that 17% of these individuals already had diabetes, and 29% of them were at risk. The Western Sydney Local Health District has a bunch of initiatives targeting these issues, as Talwyn touched on earlier or talked about earlier. The Better West strategic priorities as discussed earlier, the promotion of a good start to health within the first 5 years to prevent diabetes later on, and overcoming and increasing diabetes prevention, screening, and enhancing community and hospital management of diabetes in New South Wales as well. And just to touch on a comparison of the hospitalisations between Western Sydney Local Health District and another random local health district that I picked, which was Sydney Local Health District. You can kind of tell from the two graphs. So Western Sydney is on the left and Sydney Local Health District is on the right. The figures kind of look similar, but once you break down the numbers, it's still quite significant that and obvious that the population in Western Sydney Local Health District are sicker or have a higher number of burden of disease compared to Sydney Local Health District. So for example, in both, digestive system diseases are still both pretty high prevalence, but in Western Sydney Local Health District, you can see that in males, there is 16,433 cases compared to the males in Sydney Local Health District, where there's only 11,531. Similarly, you can also compare the amount of respiratory diseases present in both local health districts. So in Western Sydney Local Health District, there's a prevalence of 9,107 males compared to 5,163 males in the Sydney Local Health District. Another one is comparing respiratory disease again, but with females is almost a double in figure. So in females in the Western Sydney Local Health District, there's 8,204 cases, and in the males in the Sydney Local Health District, there's 4,500. So it really shows how much sicker the population is between these two local health districts.
Hi everyone, my name is Ashley and I'll be providing you with an overview on the relevant mortality and morbidity. Okay, so this table here provides an overview of some of the commonly occurring diseases and illnesses within New South Wales and their prevalence in Western Sydney and also nationally. So some of the ones listed here are diabetes, as mentioned earlier, COPD, hypertension and circulatory disease, which all appear well below the state and national averages when we're looking here. But since 2011, those trends and diseases have changed, and particularly with diabetes, which is the next slide that I'm moving on to. So diabetes in Western Sydney in 2016 impacted over 50% of the population, with most of them either having a high risk of diabetes, diabetes with low comorbidity, or diabetes with high comorbidity. But there's also an earlier onset to diabetes in Western Sydney and also an increase in the trend of gestational diabetes, which is shown here on this figure on the left-hand side. So diabetes impacts all areas of Western Sydney Local Health District, but the areas of primary prevalence are here in Auburn Local Health District, which is seen at the bottom of this map on the right-hand side. And this trend is also higher in the overseas and Aboriginal and Torres Strait Islander population of Western Sydney. And that concludes the diabetes section. So within Western Sydney, there's a high prevalence of COPD with Blacktown, Southwest and Parramatta, which is this region here and this region here, having a high prevalence of COPD. Now, there's a strong correlation between the smoking pattern and the prevalence of COPD in Western Sydney population, with areas with greater numbers of smokers having a higher prevalence of COPD. But the difference is in South Blacktown, as you can see, there is a correlation between the prevalence of COPD and the number of deaths, which is the center figure here. However, in South Parramatta, there's a high prevalence of COPD, but a low prevalence of deaths. So in Parramatta, between 2008 and 2012, there were 4 deaths as a consequence of COPD. And in contrast, during that same period, Blacktown Southwest experienced 7.8 deaths per 100,000, which is 66% higher than the Australian average. So moving on now to mental health. Mental health has a high occurrence in Western Sydney. So Western Sydney has the highest rate of psychological distress in the country, which is a rate of 12.6 per 100 in the population. Western Sydney ranks 10th in Australia for hospitalisation as a result of mental health conditions, with South Parramatta being the only region that is below the average in Australia. So what's interesting about the trend of mental health in Western Sydney Local Health District is males in the Western Sydney Primary Health Network presented with 3 times the rate of self-harm, which is seen by this figure here, 346, compared to the rest of the population of New South Wales per 100,000 population, which is 105.3. Okay, and then moving on to cancer, which is the next topic. So there's a high prevalence of cancer in Western Sydney, with lung cancer, breast cancer and bowel cancer being the 3 common types of cancer that occur. The table on the left-hand side here indicates the deaths associated with lung cancer. And as was the case with COPD, there is a strong correlation with the smoking patterns for Western Sydney and the highest proportion of lung cancer. So these occur in the Blacktown area. So Blacktown Southwest and Blacktown Southeast have a higher than average death rate due to lung cancer of The Blacktown Southwest and Southeast have a higher than average death rate due to lung cancer of 21.2 per 100,000. And this table on the right shows the details for, the map on the right-hand side shows the prevalence for bowel cancer in Western Sydney during a period of 2009 to 2011, which shows that which had a rate of 9.6 per 100,000, which was well above the Australian average for bowel cancer, but that's attributed due to the low screening rates, as Western Sydney is one of the lowest bowel cancer screening rates in Australia. In comparison to lung cancer and bowel cancer, breast cancer has a lower rate in Western Sydney compared to the New South Wales population. However, there is low participation in Blacktown area here and the central region here of Parramatta, which contributes to the higher number of deaths in this area. So now looking at the overall death rates here, overall there's a significant difference in the rate of death between males and females in Western Sydney. Males have a higher death rate of 609 per 100,000 and females have a rate of 452.9 per 100,000. So in comparison to the state average, which is seen here by the blue dotted lines for both males and females, males in Western Sydney have a significantly lower death rate compared to the rest of the male population in New South Wales. In contrast, females have a marginally higher rate of death in Western Sydney compared to the state average. However, this trend is not consistent with the Aboriginal population in Western Sydney. So the life expectancy for males in New South Wales is 78 years, and for females is 84 years. For the Aboriginal and Torres Strait Islander population in Western Sydney, born between 2010 and 2012, life expectancy is 69.1 years for males and 73.7 years for females. And so the leading cause of death in Western Sydney, as seen by this figure here on the right-hand side, was malignant neoplasms, mental disorders, circulatory diseases, and respiratory disease. And this section here shows all the remaining causes for a death in Western Sydney. And finally, we'll be looking at some of the trends for mortality within Western Sydney. So this section here on the right, this section at the top here indicates the rates of death for perinatal mortality and infant mortality in Western Sydney, which is compared to the state average is a little bit higher. And also with child and adolescent mortality, the leading cause of death was intentional and unintentional injuries such as car accidents, suicides, and cancer. And also, just as discussed in some of the topics earlier, highest rate of premature adult mortality, as in this table here, were seen to be cancer, and the highest rates. As discussed earlier in some of the other topics, the highest rate of premature adult mortality are seen in this table. It indicates that cancer and circulatory system diseases are the highest cause of premature mortality in Western Sydney, followed by external causes, respiratory system diseases, and endocrine diseases. So that concludes the mortality and morbidity section of the environmental scale. Okay.
And these are our references.